seems to be ready. Looks like... Hey, how are you? I just noticed the time. You must be my 5 o'clock appointment. Perfect. The full cranial nerve exam. Is that correct? Good, good. Well, let's not waste any time. We can get started. If you don't mind just sanitizing yourself before we get started, just to make sure everyone here is clean and nice and healthy. And you can just put your hands out for me. There you go. And it's just a safety precaution we like to take. Sanitizing here at the hospital is very important, especially at a time like this. I'm sure you saw the hundreds of sanitizing stations. Okay, yeah. Well, looks like we have most of your basic information on file here. If you don't mind, I'm going to be asking you some more preliminary questions, just to give me a solid grasp on how you've been feeling since your last exam. As you know, we're just testing some of your senses, your sight, smell, taste, hearing. I might be even doing some muscle tests on your face and your arms. Oh, yeah, very basic. Shouldn't take too long. So, how have you been feeling? Okay. Alright, now is it a consistent pain, or is it just coming and going? Okay, that's good, that's good. Either way, I'm sure we can take a look into it. If it's not as bad as last time, it should be great. And, how are you sleeping? Okay, that's always a problem. Well, we're here to specialize in that as well. On average, how many hours do you think you're getting a night? Just say in the last week or so. Okay. No, it's normal, especially nowadays, but if you don't mind just letting me get up close and personal now that we're both sanitized and I got my gloves on. Okay? I'm just going to have you keep your face very relaxed for me. Just feeling around. Any pain when I'm feeling your temples here? Okay? Have you been having any headaches recently? Okay. Good, good. I'm just going to push down on your eyebrows. Go ahead and push up. Resist, resist. Okay. Go ahead and push down on your cheeks here. Go ahead and smile big. Push up with your cheeks. Okay. Good, good. I like that. Now just go ahead and just squeeze your eyes really tight for me. Don't let me open them. Don't let me open. Okay. Resist. Perfect. Now you can just get your arms out straight like this, almost like you're Frankenstein. Alright. I'm going to pull down on them. Go ahead and resist. Okay. Same thing. I'm just going to push them up. So go ahead, resist, resist. Okay. I'm just going to feel your arm here. Let me know if you're feeling any pain at all. Anything up here? Okay. How about down here? And here on your wrist? Okay. Your other arm here. Biceps good? Okay. And your wrist? Good, good. Alright, your muscles seem to have checked out just fine. If you feel any pain anywhere in your arms, head, chest, torso area, let me know during the test. Okay. Any shortness of breath? Alright, good. I'm just going to do a quick little measurement here. Alright. You can just relax. I'm going to put this right here. And just follow my lead with a deep breath. Ready? Breathe in. Through your nose. And breathe out through your mouth. Good, good. Once more. Breathe in. Breathe out. Okay. Now I'm just going to put this on your back if you don't mind just moving your arm. There you go. Once more. Breathe in. Breathe out. Okay. Not bad. Not bad. Definitely heard some congestion there in the lungs. Is there anything that has been hurting you in terms of breathing lately? I noticed you said you didn't have any shortness of breath, which is fantastic. Maybe tonsillitis? Have your tonsils been swelling up at all? Have you felt like there's water in your breathing, a little raspiness in your voice? No, okay. That's good. Don't worry. Okay. Alright. And we're just going to take a quick blood pressure test. It's here in my handy-dandy blood pressure bag. Here. Oh, it's nothing to be afraid of. Got our barometer here, and we got our little pump. So you can just hand me your arm there. Okay. Is that nice and snug? Alright, good. Gonna make sure we have our measurements here. So go ahead and just relax yourself. Please do not flex your muscles. Don't hold your breath. Act as if everything is normal. You're doing great. Okay. All right. I'm sure that was a nice tight fit there. Okay. Yeah. And blood pressure seems to be normal, which is fantastic. Definitely gonna save us a lot of time. Now that we got most of your vitals, let's go ahead and go into your sight. It's a very important test, you see. We do have this light here, okay? It is a pretty powerful light. This one's not going to go in your eyes. I have another one for that, but for now, instead of the light, I want you to focus on this red line right here. Okay? So all you have to do, just keep focusing on that. If I move it, don't look at me. Keep your eye on the line, okay? Just follow that line. Perfect. Keep following it. There you go. You're doing good. That's good. Okay. Any discomfort? Good. Alright, so let's go ahead and test your peripherals. I'm going to need you to look directly at my nose, okay? Let me know when you see that red line enter your peripheral vision, okay? Good. Good. Okay. Once again, keep looking at my nose. Okay. Good. Alright, well, looks like your eyesight seems to be good there. Let's put that light away, and we'll be using it later to take a look inside your mouth there. I'm going to have you pay attention to my fingers here, okay? Nice blue gloves. You can go ahead and just keep an eye on both of these fingers. Alright, they're going to be staying together, and you just keep watching them. Right there at the tip. Okay. Got you on that one. But seriously, go ahead and let me know which finger you see wiggle. Okay. Good, good. Good. Okay. Good, good. All right. Good. Okay. Both. Good job. All right, very, very simple. Let's go ahead and test the dilation of your eye there. I have my little handy-dandy, trusty little multi-tool here, and it actually comes with a pretty nifty light on top. Not too powerful. It won't hurt your eyes. So, got that on there. Now I'm just going to have you stare directly at my nose once more, and I'm just going to be shining this light there. Just want to watch your eyes dilate. Okay. All right. Okay. All right. Not too bad. Now, is there much pain when looking into the light? Not much pain. Okay, good. A little sensitivity. Most people do see that. It is a blue light going directly into your eye there, which could be a bit uncomfortable at times. Okay. Put that away, and it looks like your eyesight's looking great, so let's go and move on to your smell. How does that sound? So, I have two smells here, okay? Both in glass tubes, and do not let the color fool you. They have nothing to do with the smell. I just wanted to make it a little bit more fun for people by putting some food coloring in there. So, let's go ahead and start with number one. It's going to be this red pink here. Okay, good. Go ahead and take a sniff. Good. Strawberry watermelon. Oh, definitely one of my favorites. Okay, here's this next one here. It's a nice little purple blue. Let's see if you can guess this one. Mixed berry. Okay. Blueberry was a fine answer. Don't worry. Not many people can get them that spot on. You have a pretty good sniffer there. Alright, let's take a look into your mouth, because I'm sure that's going to definitely affect your taste. I didn't want to mention the liquid earlier that I thought I, felt in your lungs when taking the stethoscope breathing test there, but I'm sure it's nothing. I have these little wooden sticks here, and it's definitely going to help us, push down on that tongue there so I can get a good look. Yes, we'll be using the stronger light for this one, so if you can just open up and say, ah, for me. Okay, stick your tongue out. Alright. Don't worry about it. You're fine. You're fine. Okay. And can you breathe properly? Good, 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 good. Okay. So, I am seeing some inflammation in the back here, but it's nothing to worry about. We're going to go ahead and take a look at that. It's easily fixable. Okay, go and close your mouth for me. Now, do you feel any pain when air was touching the back of your tonsils? Any sensitivity at all? Okay. You can just say, oh, once more. Once again, sanitize, totally fine. I'm just going to take a poke around your mouth there. Be feeling around your gums, see if there's any sensitivity, any infected areas there. This job usually is for a dentist, but right now with what's going on. We're trying to fit in as many exams as we can, so just go ahead and say, Yep. Okay. Alright. Any discomfort at all? Okay. Not too bad. Alright, you are doing fantastic, by the way. Flying colors so far. So, we got your sight, we got your smell, and I took a look at your taste buds also there with the sensitivity test. Your taste should be fine. Again, just a little bit of swelling there in the back with the tonsils. No worries. We're just going to go ahead and get your sound going there, okay? So I'm just going to say things at a very low volume and a very high volume. It's not going to be any discomforting volumes there, but I just wanted to make sure you can understand exactly what I'm saying. Yeah. Essentially, I'll be speaking, and you need to discern what I'm saying. It's going to sound very silly, but it is a test that works. Alright, so go ahead and just close your eyes for me. Yes, we've had people read lips, look at body language, and it can definitely help with discerning what the language is and what the person is saying. Alright, so I'm just going to say a sentence, and if you can repeat that sentence back to me, you let me know. I know. As I said before, it is very silly sounding. Sure, I'll do it once more. I took my dog on a walk, and after that, we went to the grocery store. It's definitely one of my favorite parts of the test. Okay, good. You got the beginning. Okay, I took my dog on a walk, and then we went to the grocery store. That's good. Let's go and run through 2 more sentences. It may be easier, maybe harder. Okay. The skeleton has no body. You got that one. Okay. The skeleton has no body. And last one. Be sure to wash your hands after you use it. Be sure to wash your hands after you use it. Be sure to wash your hands after you use the restroom. Okay. Pretty silly test, I know. So, you did fantastic with the hearing test as well. Congrats to you. That was absolutely fantastic. I did want to run through a quick test as well, because I noticed you had a lot of little things floating around your face there. You did mention you weren't able to get a lot of sleep. I did have a prescription for that. I was going to definitely give you when we get out of here. As for the tonsillitis, possible tonsillitis, I would probably recommend hot teas, hot soups. I would stay away from anything sweet because bacteria could grow in the back there, and it's amplified by sugar very, very much. Make sure you're brushing your teeth. A nice mouthwash is great, but definitely salt water works best. Okay. We are just going to do your taste test, and then we'll head out of here with your prescription. Okay. Your taste test is just going to be a cotton swab right on your tongue there, specifically placed on different taste buds. Oh, nothing to worry about. I have my flavor chart here. All I'm going to do is just rub on a little flavor profile right at the tip there. they're all clear. So go ahead and open your mouth for me and say, Okay, close your mouth. I'm just going to twirl it around there just so you can get all of the flavor. And you tell me exactly what you have. Okay, perfect. That was good. Banana. Make sure you toss those in the trash can there. Okay. Next one, say Of course. Alright. Strawberry. Very good. Let's get a little bit harder on you here. Okay. Oh, God. Okay, you didn't like that one. Alright. Nope. Totally fine. Not everyone likes that one. That was mustard, horseradish, rice, chicken nuggets, ice cream, vanilla ice cream, and seaweed. Yeah. Definitely not a favorite. Raining Q-tips. So, I'd say you did fairly well on that taste test, but we're going to get really close up here because I did notice you had some negativity floating around there. Yes, it can be very frustrating sometimes, but we're going to go ahead and pluck away all that negativity. Definitely helps with a good night's rest. Alright, let's go ahead and get in there. Pluck, 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 pluck. Pluck, 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 pluck. Oh, look at that. Self-doubt. You don't want any of that. Pluck, pluck, pluck. Ooh. And get those insecurities out of there. Pluck, 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 pluck. Toxicity in a video game. Come on, what are we, 12? Pluck, pluck, pluck. Pluck, 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 pluck. Okay. Looks like we got a lot of your negativity out of that space there. Definitely prescribe you something to help you sleep before you leave. Are there any questions you have before we finish this up? I would say overall you did fantastic. It's definitely much better than most of our patients. You flew through it and you passed with flying colors, I would say. The only worry I would have would be your tonsils right there in the back of your throat, and most importantly, that liquid I may have found in your lungs, but not too much, nothing to really be worried about. I would say continue doing what you're doing. Again, hot teas, hot soup, mouthwash, but salt and water is much, much better. Make sure that water is warm. Definitely stay away from sweets for some time. Can, again, grow that bacteria. Yeah, no, of course, of course. So, I do have this on standby because most people do have trouble sleeping, but it is our melatonin. It essentially is sleeping tablets, but a very natural sleeping tablet. It's a patent-controlled release formula that can give you up to 8 hours of sleep, really restful sleep. It is 10 milligrams per tablet. It's not too hard on the body as well. You got full directions on the back of the box on how you should be taking it. It's also seen as a dietary supplement, so take this about 30 minutes before going to bed every night, and I can guarantee you, you can have an extended release sleep. You can wake up and sleep through the night and wake up refreshed. Oh, of course, yeah, please. Just be sure to pay attention to those directions. Taking too much of it can be a bit dangerous. Of course. You know we're always here to help. Okay, yeah. If you have any questions, go ahead and just drop it off at our receptionist, and I'll be sure to get back to you. fantastic. I can't wait to see you next time. And once again, just take care of that throat and get some rest. Okay, have a good night, and hey, don't forget to smile. Positivity is key. You'd be surprised what positivity could accomplish. Okay, have a good night. I'll see you next time.